And just like this, all I have to do is just put a downward pressure exactly as the force of gravity goes on us, straight down, which herniates the disc out. And that's exactly what they look like. So one of the things us chiropractors deal with almost on a daily basis are patients with disc herniations. So I wanted to just shoot a couple quick minutes, just do a little short video, a little FAQ on exactly what happens with a disc herniation, what does it look like, and more importantly, why is it that you should see a chiropractor, and what are some of the things that we can offer for patients that have disc herniations. Now, a couple misnomers again out there. I love doing these misnomers because there's a lot of misconceptions. The misconception number one, and we see this a lot, is that if you have a disc herniation, you can't go see a chiropractor. There's nothing farther from the truth. Besides our manipulation that I've demonstrated in the past, one of the things that we do in the office, we have a lot of low force methods to manipulate and to mobilize the spine and to create a pressure lowering effect on the disc and in the spine itself. So I brought my trusty model here. So I wanted to show you guys a little bit about what exactly a disc herniation looks like. So you can see right here we have our spinal disc and it's sitting in between two vertebrae. That little spot right there, as I apply pressure, what happens is that you'll start to see some of this disc material bulge out. And you can see how I do that. This is under an increased amount of pressure. And you can see also that when there's a pressure is increased, sometimes it gets to the point where it actually touches that nerve. Now, when disc material leaks out of the disc like that and contacts the nerve, we can get all kinds of symptoms that go down the leg, into the toes, into the feet. These are our numbness issues, tingling issues, pain when you walk, pain when you sit. And you can see right here, as we increase the pressure put on the spine, you can see that herniate right out like that. And just like this, all I have to do is just put a downward pressure exactly as the force of gravity goes on us, straight down, which herniates the disc out. And that's exactly what they look like. So one of the things that we talk about in the world of chiropractic, in the world of disc herniation, is we want to help to lower the pressure there. As we can lower the pressure here and sort of cancel out the effect of gravity, then what we can do, come on in a little bit closer again. What we can do is, as we cancel out the effect of gravity, we can actually help to take a little bit of pressure off the disc, just like that. A little bit of pressure off the nerve, just like that. And there's a lot of different ways that we could do that. And I want to feature one of them right here, right now. This table that I'm in front of is called a flexion distraction table. And what it is specifically designed to do is it's specifically designed to provide a low force manipulation to those patients with cervical or lumbar disc herniations. And how it works is like this. There's a lot of moving parts on this table, so whenever we have patients that come in here to try to sit, I always say, be careful, it kind of acts like a trap door sometimes. But one of the hallmarks of this table is that we can put the patient here prone, which means face down, and the patient's legs are right here. And what we can do is we can then drop a person's legs like this. What that does is it creates a negative pressure, basically a pulling apart right at that vertebral level, okay? As we start to pull apart, we cancel out some of the effects of gravity and have a better effect in taking pressure off that nerve. Another thing that we can do with this table is we can actually draw the patient outwards like this. And you can see it actually come out in this direction. So when the patient lays on this particular table, what I'm able to do is to provide an adjustment by dropping their legs, putting a little bit of pressure up here on the spine, and then we can draw their legs out like that. You know, a lot of patients report that they feel a little bit taller when they get off of this table. It's actually somewhat true, although temporarily. Most of our spinal height as we get older is lost in the discs. So as our discs wear down, roughly somewhere between 20 to 30% of our height actually comes from the fact that our discs are wearing down. So yeah, if we're able to draw the disc apart a little bit, that way that allows the disc to hydrate a little bit more, yeah, you know what, you maybe could get a centimeter or two just for a little while. Another cool thing this table does, not only can I traction or actually pull the legs out like this, and we can drop the legs in a very comfortable low force manner, but I can also, when the legs are dropped, we can also move them in circles. Just like this, we can get all the range of motion up on that vertebrae, up on that spine. And my hand is always right here over the segment that actually has the issue. So if you have a disc herniation at L4 and 5, I'm gonna be right here at L4 and 5. And so when I go like this, I can create all of that traction force. I can create all of this, what's called circumduction and rotary force, all right there at that particular vertebrae when it's needed. And this is a really, really effective method to treat disc herniations. It doesn't involve a high force manipulation. It doesn't involve what's called a high velocity manipulation. This is low force and a lot of times even low velocity. It's very comfortable, patients love it, and patients get better.